Hello and welcome back to the Lee Summit Town Hall podcast. I'm your host, Nick Parker. This is a good time to remind everybody that this podcast is brought to the good people by Budget Blinds of Lee Summit, your home for signature series shades. They're also a great local company running a great local business. They've got all the things you need for your window treatments. They even do some decoration stuff. I've got a little throw pillow I designed and made in there. It's pretty cool. You should go get there. Go in and see our friends at Budget Blinds of Lee Summit, right in the heart of downtown. Tell them Nick sent you. I've got a returning guest and a new guest this week. It's September. We're in September. This is weird. Mm-hmm. I feel like the fall or the summer didn't happen, and now we're in fall. But September is Suicide Prevention Month, and I brought back our good friend Kirstie Millar from ReDiscover. And she says I'm not enough, so she brought another guest. She brought Heather Mason, also from ReDiscover. Welcome, guys.
Thank you.
Thank you for having us.
Welcome back, Kirstie.
Thank you.
I feel like someday I should have you on for something other than talking about suicide and suicide
I
prevention.
can yap.
Waffles.
Professional yapper.
Yeah, the pre-show, there was a great conversation about waffles.
Waffles and ghosts.
Yeah. I feel like that needs to be a dissertation somewhere.
Probably.
Waffles and ghosts. Also, I want waffles really badly right now.
I want to see that throw pillow you were talking about.
Yeah.
It is cool. It's really cool. You can go in. They've got a little program. You design it. They get it. It's like printed on the fabric.
Oh,
That's
nice.
cool.
Very cool.
Yeah, and then you come back. When we did it, it was a wine and pillow party.
Ooh.
So you went
Even
in.
better.
We had some wine, hung out, designed a pillow,
Then took a nap.
and should have.
On your pillow.
Yeah.
It's been designed. Wow, what a great idea.
It's a good little program. You should go see them.
Yeah.
Very cool.
They are awesome. Well, I have had a few different ways. I thought about this as last week after we talked and we were setting this up, and I had a few different ways I wanted to jump in, but I'm going to jump in, I think, the more awkward way.
Bring it on.
So, Kirstie, we met a few years ago. There had been a handful of suicides kind of successively in our community 5 or 6 years ago. And then the community got together, created a little youth task force, kind of youth mental health and suicide prevention task force. It's morphed into some different things over the years. And my thought is, the thing I kept coming back to is, I think culturally, but I like to focus on Lee Summit as a community, we are really, really, really good at the response and the reaction. Mm-hmm. How are we doing in the keeping it going and looking at the keyword to this month, prevention,
Sure.
as well as just responding to tragedy?
It's a great question. Thanks for asking.
That's the answer that says, I need a minute to think about how I want to respond to you. I know it's the awkward way, but
I'm also happy to jump in a little bit to start how we've launched our co-responder program to be more preventative. So looking at Lee Summit specifically and as a region, we have then launched in October 2020, Lee Summit did a pilot program with the police department where we embedded a ReDiscover staff member with the police department to respond to active 911 crises calls. So that has now expanded. In Lee Summit, we now have 7-day coverage with our co-responder. We have 2 co-responders, and they respond to really any call they feel like they can be add a meaningful impact to, whether that is somebody who is feeling suicidal, struggling with substance use, going through a breakup. Sometimes it could be something related to domestic violence. Sometimes it's a speeding ticket. That can be stressful as well. So we look at ways that we can follow up and intervene in that moment. And so our goal is the more that we are showing up during that crisis situation, that we can hopefully then have more of an impact moving forward, and we get those referrals quicker to Kirstie's program, but also hopefully that we can de-escalate a little bit more so it doesn't escalate into something bigger. And I know we'll talk about 988 later, but I love that Lee Summit really launched this program. They kind of made it their baby, and they were the first one in our region. Since then, Raytown and Grandview have also adopted the same program, but Lee Summit really led the way with that in 2020.
And I think on top of that, that movement has really pushed breaking down the stigma, which is such a corny way to continue this conversation, because that's like the repetitive language, right? Like we forever want to break the stigma. There's a stigma around it. And I think we have to recognize that's forever going to exist. It's a human nature. For some reason, we treat above the neck different than we treat below the neck in terms of psychology, medicine, all the things. So what the programs like Co-Responder, like 988 have done is perpetuated conversation. It's also de-escalated needing 911 and police in a non-invasive way co-responders can go out and it's not all these squad cars and lights. It's a professional. It's teaching the community what their resources are.
Right.
I think the unfortunate reality too is, I'm going to make myself sound like such a nerd, but I had this thought-provoking conversation with my bestie ChatGPT recently.
It is really her best friend.
It is, except for lately I've seen the new post and I think we have to break up. But I did have a conversation with it about the system and the thought-provoking question that it proposed back to me was, how do you fix it? Do you slowly fix it like a railroad track as you're going, or do you totally blow it up and rebuild it? And I don't think there's a right answer for mental health, but how we have targeted prevention is teaching people how to navigate the system, because it is such a broken system. You can have the best insurance in the world and still have to pay $100 copay per session for therapy. Like, it is just not accessible like it should be. And so it finds itself in these larger conversations, and I'll stay large in the sense, but there's scary things that happen in our world, and mental health somehow always ends up being the center of those conversations. And I think the reason for that is the lack of it, the lack of understanding the importance of it. You've heard me say this 1,000 times to Tuesday, and I'll continue to say it till I'm blue in the face. We are required physicals for kids in school. There's no mental health requirement.
Right.
Why are we not assessing? People don't know how to parent their children when they're in a mental health crisis. I'm a therapist. I do this for a living, but I always say to parents, I don't think I could have the hard conversations with my children. And that's okay. But I also know a circle of people that I can beep, boop, beep. I can't do this. Right. She or he is not okay. So I think it's education, but people are uncomfortable.
Are there two sides to this conversation? One of them is, I feel like we circle this a lot, the broken system. Right. Mm-hmm. Or just a system that was never built for this. Mm-hmm. I mean, like you said, we're great with below the neck. Mm-hmm. And then the other part is just they're related in that we've spent the last 5 generations, you don't talk about it.
Yep.
And not just you don't talk about suicide, which we've talked about before. Like, my entire industry of news, we were taught you never report on a suicide. Mm-hmm. But I think just we don't talk about mental health.
Nope.
I mean, PTSD for our my World War II grandparents was shell shock, right? Mm-hmm. I mean, just the language hasn't existed until recently.
No. Well, you bring about one of the biggest myths that is out there. If you talk about suicide, you're going to put it in somebody's head. Mm-hmm. And so there's a lot of fear around that. We know that's a myth. And actually, the more you talk about it, the more you create a safe space. If someone's thinking about suicide, they're already thinking about suicide. So by opening a conversation and having a safe space to be able to talk about it, like Kirstie said, we kind of break down the stigma, and then we can offer support and help instead of shame, guilt.
And here's where
I think that blows everybody's mind.
Yeah, here's why I come in with this statistic. Told you I'd have them. But I have 2 qualms with statistics in terms of suicide prevention. The first is they're underreported. It's not like somebody dies from suicide, we can't do an autopsy and understand how many times they thought about it, how many plans they made. So everything we have is reported, which means it's underreported because of exactly what you were just saying. There's a statistic that floats out there. Don't quote me because I may not get this one right, and if you know better, check me. But it's something like per day, 25 attempts are reported, but it's over 1 million that are actually attempted in the world, not just our nation. That may be a large
25
stretch.
Are reported.
I read that in an article once, and I can't give you a citation, so take it with a little grain of salt.
Okay, even if you're
think about
over-exaggerating that a little bit.
Yeah.
25
Get to the point
reported,
where they speak to someone like Heather's co-respondent.
But there are probably closer to 1 million actual attempts.
Who wake up and go to work. That's not the statistic I was planning to share, though. In line with what Heather was saying.
Again, mind blown.
Absolutely. Because people wake up, it didn't happen. I mean, I had that conversation just last week with someone. Didn't tell anybody for 2 weeks. But the statistic I was going to share in line with what Heather was saying, I share that qualm because I believe this is also a very underreported number. But statistically speaking, if you think someone in your world is struggling with suicide, at a minimum, they've thought about it 4 to 7 times. So like Heather said, talking about it isn't and the same thing is true for lethal means. There's this fear of, if I ask you if you have access to a gun, you're going to go seek a gun. If you think they're thinking about a gun, they've already thought about it. So having that conversation opens it up. Now, here's my other qualm. I do a lot of suicide prevention education. You're hearing Heather and I say, just talk about it. It's a simple thing. It's not an easy thing.
No.
It makes it any training I do, it makes it sound like I'm just like, oh, sit down with your buddy. How you doing? You thinking about killing yourself today? It's not that simple. We are professionals. Either side. We are professionals, and I don't want to speak for Heather, but there are days where I'm like, oh hell, I don't know how I'm going to react if this person says yes. I've had to tap in Heather's team, and because my team can't handle something on their own because we need that backup. It is not an easy thing. It is simple on paper. It is not easy. So it's recognizing that.
I think, yeah. And I'm thinking of this as a parent perspective. And I think that's what we talk about a lot. It is hard enough as a parent to get up the courage to ask the question, to ask your kid that question, because we want to fix everything. We also want to believe that we've done a decent job because, listen, as a parent, if they say yes, it's automatically our fault.
100%. Let me say 100% they think that.
That's what I mean.
It's the parents' fault. Let me clarify my 100%.
But I mean, that is, I'm going to probably close to 100% of the time, that's the reaction.
Sure.
Because we think however they are is because of us, good or bad.
That's the missing link, in my opinion, in the system when it comes to kids. Because parents are, and then the reaction past that, I'm angry. Yeah. I'm frustrated, or shoot, like the situation you shared with me, now my plans have changed.
Yeah. Because
I have to go be a parent. And I think that there's this lack of space that two things can be true. Your kid can be struggling.
That's the thing in so many of our society
100%,
problems.
But in this bubble, we don't let parents be human. We forget that piece.
Yeah.
There's not often a follow-up space. And people like the co-responders 988 hold space for that. That's really where the expansion has come in, is Heather's program. If they deploy out, I don't want to take away all your explanation, but I've seen it where her people hold space for both parties. The kid is assessed and the parents are given the opportunity to debrief.
Absolutely.
That's the missing piece.
Especially more with our mobile crisis response team, because that's the team that is mostly without law enforcement, and we send 2-person teams out because we know that there's a lot of complex family dynamics as well. And so we want to hold that space to say, okay, you're valid and feeling really overwhelmed with your child who's struggling, because both are valid. And this kid is valid in whatever they're struggling with. And so it's usually breaking up. Let's take a walk. Let's talk it through. How can we come together to find a common ground that we can provide support without, I don't want to say overreacting, but obviously you love this person and you want to get them all the help, but we're there to provide those recommendations of here's what we think is really needed at this moment to truly support what they're saying.
Yeah.
And I think we talked a lot about breaking down the stigma, but also reducing silos is huge.
Yep.
And having better handoffs to other programs and teams and working together as a community versus all these different silos that we've always had.
So what do you mean by the silos there? So like what little columns are you talking about?
Gosh, there's so many. I think between, even historically, you've got law enforcement wearing multiple hats going out. Now they've brought in a trained mental health professional to work alongside them. So instead of law enforcement now having to go out and handle the scene and make sure that everyone has referrals while they're also managing everything else in the city, now they have that trained professional to do that. Then we have people following up with that crisis situation. And then we have a way to make sure they're getting linked to whatever service, whether it's internal with us or whether they have an outpatient provider. We're still working on the silos because, yes, if you look at HIPAA, FERPA, all these things, but we have people embedded in schools now. There's just a lot more community collaboration, and we're recognizing that need so that the school isn't just providing one thing. Over here, your doctor's office is providing another, like really holistically working together to support the person.
How has the response from law enforcement been on that? Because I feel like do you get pushback in that? We talked about that with former Assistant Chief Dan Manley was on that original group that got together in the community, and he's since retired. But he was real big. I mean, he really pushed hard to get those first kind of pilot programs almost.
He saw the need.
Yeah, but I mean, how has that been? With them, has that side of it seen the opportunity to take care of things that they're not
Yeah.
I mean, they don't have that kind of training.
Yeah.
Of all the many trainings they have.
Yeah, they're doing wonderful. Honestly, the co-responders have done such a beautiful job of getting in there, building rapport, showing, hey, here's what I can do. And the moment an officer sees that, oh, yes, this is a service that matters to them because it makes their life easier at the end of the day. We've had a lot of great buy-in. We do surveys with them. And one of the questions we ask is, has the co-responder been beneficial to you? Overwhelmingly positive. Overwhelmingly positive. So, yeah, based on our surveys, interactions, absolutely. With anything, it takes time to change a system because that's what we're doing. Officers have been doing a phenomenal job of going out there, de-escalating, and doing what they need to in those moments. They are absolutely capable, but is it the right service? It's bringing the right person to them. So essentially now, instead of having to go into a hospital or all these other services, we're bringing the service to the person to really help and provide, let's get you from A to B instead of, here's a really long list of resources, call all of them and good luck. So the goal is really to do that warm handoff and let's de-escalate and then get them to that next service. So
I also think it shows the community members the collaboration that we're talking about. I think back to, we had a case where we had to share and unfortunately had to involve law enforcement because it escalated to a point where it was out of my staff's hands. And I had to call Heather's team to come help be that liaison. I don't have the relationship with officers like Heather's team does.
Right.
But what it showed the individual in the moment was we're going to do everything we can together to keep you safe. It's not just ReDiscover now keeping you safe. It's also law enforcement. That was a huge picture for that person. They came around and they were like, gosh, that was really scary in the moment. But I recognize now you made some really hard calls. But because we had that liaison, so to speak, there, the officers are already trained to do what they're doing, but were welcoming and calm and, and really followed our lead and let us take control where we needed them to fall in. I don't want to say fall in line like we're their leaders, but it was very collaborative. It was something that I haven't seen in the past because of those silos. Not that officers have never not been willing, but it oftentimes looks like, well, I don't know what to do as the provider, so let me call 911, and now I almost lose credibility with you because I've escalated this to a point that you didn't want it to be.
Right.
Instead, here I am saying, let me call in a team that I trust. So it's just a different lens for the community as well. You're not in trouble when the police are there. They're here to help make sure everybody stays safe. But the provider's still taking control of the conversation.
That's, yeah. So it's almost packaging it.
Mm-hmm. Mm-hmm.
But I think that's breaking a stigma too, right? Like, I think we're all in our brains trained that if a police officer shows up, somebody's in trouble.
Absolutely.
Oh, I still adjust myself when I drive by one.
Yeah.
And I'm not doing anything wrong. Let's be honest.
I got to sit up straight. The officer might be after me.
Might notice that I'm slouching in my chair, in my car.
But I think, that's a great point. Is even just that subconscious, like, oh yeah, somebody's, and I'm
policing
me.
me.
I'm of the age that I still sing Bad Boys, every time I see the lights turn on, right?
Yeah.
I think it also shows that, like Heather was saying, that overreaction of hospitalization doesn't always have to exist. We actually we didn't design it. We found a thermometer, my team did, and rediscoverized it, we like to say. But it's essentially showing the range that suicidality is. I think old school thinking, I like to say old school thinking is like someone sneezed wrong and someone's like, you're suicidal, you have to go to the hospital, because it's seen as this liability. In our world, it's seen as this liability of like, your life is now my responsibility because you've uttered this word. Mm-hmm. So it's not just teaching the community these collaborations, it's also showing that, I have a terrible analogy. I'm my father's child through and through, but suicide is like a rash. Sometimes it's a side effect of of a medication. Sometimes it's chronic, it comes and goes. Sometimes it's a random irritation that once you treat the irritation, the rash never comes again. And sometimes it appears randomly and it goes away on its own. Like, we don't know enough yet. So there are people who will live with suicidality for the rest of their lives. So our job isn't to throw them in a hospital the moment they scare us. Our job is to teach them how to live with it. And then to utilize the services when it gets to a point when they don't think they can live with it anymore.
Well, and speaking about statistics, we know that hospitalization can often do more harm than good when it comes to somebody who's struggling, especially with chronic suicidal ideation. And what actually is the most helpful and biggest impact is by all these wraparound services we've been talking about. And so historically it's been, get them to the hospital. But really, we know that ultimately can sometimes worsen. Not all the time. Sometimes it's absolutely needed. Sometimes it can worsen those symptoms, though. So we are really here as a community to wrap in those supports and make sure that individual has what they need to hopefully lead a better quality of life and not have to struggle so severely with that.
Mm-hmm. I feel like we probably all know one or two people where they went in for hospitalization, and when they came out, it was worse, and it was successful afterward.
7 days post-hospital stay is the highest risk.
Wow. And now I'm thinking of the two people, and they both fell in that 7 day. I'm also going to say that was not a bad analogy. That was a great analogy.
It's cheesy.
Okay,
it sticks.
But I think it does stick. I want to go backward a little bit. What are conversations, or how do we approach conversations that we should be having so that we don't, I don't want to say that we don't get to the point that we're making the call, right? Mm-hmm. But I think so that we're maybe prepared for when we do, because I still think, look, I told you of an incident where, it took 30 minutes to make a call. Mm-hmm. And I think to get everybody into that headspace where it was okay. But, how do we get to where we're ready? We can recognize when, and we are emotionally, mentally ready to say, okay, yeah, we recognize it. Now we have to do it.
I think there's layers to it. I think it's understanding the resources and what they do. I also, another analogy sort of, I do a lot of education to parents, and I like to compare the suicide conversation to sex. They're both uncomfortable.
Yes.
They both have life-altering outcomes if we don't talk about prevention services, though. So how do we get comfortable? And honestly, societally speaking, globally speaking, we expect schools to have those conversations. Mm-hmm. Or we lean into religion to have those conversations. And I'm not shaming either approach, but recognizing that if we don't talk about either of those, life-altering outcomes are going to happen. It's naive to think kids won't struggle mentally. It's also, in my opinion, naive to think kids won't explore their bodies.
Yes. And I'm going to say about both topics, I am a staunch defender of all things teachers, mainly because I don't want my wife or my mother to beat me. But they're not trained.
Absolutely not. I come from two teachers.
And all of those things that they are trained for and that they do on a daily basis are already way too much.
100%.
And then if we are expecting a teacher to do that, that's one more thing for them to tackle
because
that they are really not prepared for.
100%. It's uncomfortable. So it's approaching, that's why I say I compare the two. You have to approach suicide and mental health really like you do sex. You have to start having those conversations age appropriate.
And the signs and symptoms aren't always there, so you can't just try to wait until, it looks like my child's isolating.
Well, you can't make it this is the 4th grade program.
Exactly.
No.
Right?
Yep.
I mean,
but months like this I know we're getting into it, but like if there's a time where a parent is struggling to figure out, I don't know when to bring it up, loop it into what's going on in the society. So September, Suicide Prevention and Awareness Month, we've got, when big things happen, using that as an opportunity to talk about it. We see things on the media all the time. Hey, that was really concerning. Can we talk about this? What were your thoughts? Have you ever struggled with that? I think you can pull in even songs, kids are attached to music. There's a lot of songs that are, deep and about heartbreak, depression, even suicidal ideation. Mm-hmm. And you can use those as a way to kind of casually broach that topic sometimes. And the kid may say, gosh, Mom, I'm fine. It's just a song. Okay. But it's a way to sometimes bring in those conversations as well.
Well, look, a teenager is always going to do the, gosh, it's just, whether they're there or not. I mean, exactly. Like, you think about it, when we were teens, that was exactly how we responded too.
Mm-hmm. I also think verbaging it, that it doesn't have to be traditional guardian or parent that they talk to. Mm-hmm. When we do education, it's not mom or dad. I don't know your home situation. You may not have both in your home. You may have 2 moms. You may have 2 dads. You may have grandma, grandpa, mommy, and dad all there. But also, like I said, my kids are blessed because their mother is a therapist. But I don't anticipate that they're going to always come to me with their stuff or their dad. I have a village of people that I hope they go to someone. Is it going to hurt my heart a little bit? Yes, it already has. She's told her dad her first crush before she told me. Hello?
Oh.
Yeah, that hurt my heart. But she told her dad. She feels safe enough to tell her dad. She has we call them aunties. They're our chosen family. And she has blood aunties also. she's got grandparents. I also have a son, but she's older, so she's who I think of first. I don't anticipate that she'll come to me, and I'm not going to shame her if she doesn't. I need her talking to a safe adult.
I think that's a great thing to bring up. And I remember as you know, our kid is now first year college, but how hard it was to say, are you at least talking to someone?
Yep.
Is there an adult that's maybe not us? And that hurts.
Yep.
Because we want to be the fixers.
Of course.
And we want to be the confidant, right? We want that trust, but also understand that sometimes it can't be us. Or it can't even be us. Sometimes it can't be us first.
Right.
Well, and that's where I want to put the plug in for 988. This is also a great resource to use even for parents if they want to call and say, hey, how can I have this conversation? Or, hey, I have a loved one or a child or a friend's child that's struggling with these sort of symptoms. What can we do? What can we offer? So 988, it's a suicide and crisis lifeline. So it's not just for suicide. That's been one thing. We don't define what crisis is. Crisis, it looks different from me than it looks to Kirstie to you. So we really let the individual define what crisis is to them. But it is a 24/7 free hotline available nationwide. And all you have to do is call. And they'll have some prompts and you'll talk to a local person. So if I call 988 while I'm sitting at Lee Summit, I'm going to get ComCare. Their headquarters are in Kansas City. You've got local trained clinicians that are walking you through resources, conversations, really just there to kind of help de-escalate and hopefully get you a plan moving forward. They can loop in extra people if you want, or it can remain as anonymous as you'd like it to be.
I love that you said you're not defining crisis, because I think very often you'll hear somebody talk about their crisis and our response is, really? That? Because it's not a big deal to us, or it's not something that would, flip a switch in us. You got to leave that open for everybody sees things a little different.
And I'll tag
and all those other things.
Yeah. I'll tag into what Heather was saying and encourage calling 988 with your child. You don't have to keep them on the phone long if you're not in crisis and you just are curious or you want them to see a live person answers. Call. Let the provider know you're not in crisis. You're just with your child practicing, or you yourself are practicing. They won't keep you on the phone long. I help with a camp through the Blue Springs Police Department in the summers. It's called Girls on Fire. It's a bunch of middle school aged girls, and it's a half-day free camp, all female presenters, really just bringing community to the kids. And we literally put it on speaker over the microphone for 60 girls to hear. The officer simply just shares, we're running a camp. We just want the girls to hear you're a real live person. Anything you want them to know about 988. They give a 2-sentence spiel depending on the person because it's individualized. Thank you so much for your time, and we hang up the phone. My staff practice with their clients all the time. Here's what it will look like. So at 3 a.m., it's kind of the same thing like when we do education. If you've never asked someone, are you feeling suicidal? I tell my room, turn to the person next to you and ask the question. Get it off your tongue. Try it. So that the first time when you're in a true crisis is not the first time you're calling that phone number.
Well, what's phenomenal about 988 is, say, like Kirstie said, a parent is calling with their child because they're saying, well, maybe I'm feeling depressed. I do kind of want to talk to somebody. I don't quite feel comfortable talking to my parent right now. I'm not to that point, but I want to talk to somebody. Well, if you call 988, especially in, say, Lee Summit where we're at, and you say, hey, actually, I want to talk to somebody in person. I'd really love if somebody could come out here and just meet me where I'm at. We can do exactly that. We'll respond within an hour, 24/7 to that location. And so if a parent's saying, my kid won't talk to me, they're not getting out of bed, they're really struggling with depression, I think, but they want to talk to somebody, we can come and meet them right there. Their bedroom, we can meet them if they're at the McDonald's down the street. So it's a service that's available in Missouri. It's also free. It's not just 988. There's someone to call, but there's also someone to respond. So when we're looking at those mobile responders, co-responders, where our goal is to meet you both physically and emotionally where you're at and see what we can do to help in that moment of crisis.
I think I'm really struck by the thing. You both have said this. Call it and practice, or practice with each other, with you and your spouse. Like, hey, this is how I'm going to ask, or I think this is how I'm going to, because we don't know. And when you do get that courage up to force it out the first time, it's scary. It's scary to hear your own voice say it.
Yep.
And it's scary to think about what is the response going to be and how am I going to react?
Which is where I go back to, we forget to allow the adults in the situation to be human. or the asker to be human, because even as a professional, I may have a reaction. And there's this fine line of sharing. Heather, I have this really hard question to ask you. I'm feeling uncomfy, but I'm going to ask you. I'm not going to be bawling. I'm not going to be losing myself, because that takes away the moment of the person in crisis. But I am acknowledging I'm uncomfy, because I've done two things. If you've ever been in a room with someone who has big emotions, you feel it.
Oh, yeah.
So I'm acknowledging that you feel my heart racing or my body shaking, but I'm also hopefully modeling vulnerability. I'm willing to go here with you. Are you willing to meet me there? And those aren't words I'm going to say, but my actions are going to say that. And again, this sounds so simple, because on paper it's simple, but it's never an easy conversation. And I think that just has to be reiterated. This is not an easy conversation to have, but it is quite literally life-saving when we have it.
And I think we are trained from a very early age, especially with certain professions. And I'm going to say, mine as a journalist, and I think of friends who are attorneys. We are trained and educated. Don't ask questions where you don't already know the answer. And so to ask a question where it's going to be either or and you don't know.
Yeah. I also think there's this stigma, if you will, of, oh, they're just saying that for attention. That one, my response to that is, hell yeah.
Yeah.
What are we missing? They know those words are grabbing your attention. I assume they mean it 100% of the time.
Right. And if they are saying it to get attention,
what are we missing?
Let's give them the attention.
Mm-hmm. In a systematic way. The grandiose responses are where, unfortunately, some symptomologies seek that in people, because they have been brought up in chaos, and so they seek chaos. And so there's strategy, to, if they're seeking grandiosity and I reduce grandiosity to systematic and the statements stop, statistics would say they're likely seeking that grandiosity. Now, I'm not saying they're consciously seeking this, but if I'm going to systematically respond, loop in crisis when I need to, crisis loops in providers when I need to, we have a very open door, Heather's team and my team, because we have a lot of people where they're going to call 988 because they're feeling lonely and they need that attention. So how can we systematically respond to where 988 still does their job, mobile responder still does their job, but we're not, for lack of a better term, overutilizing the system and showing this individual, every time you cry wolf, we run.
Is it important, based on what you're saying there, is it important to think that when we're providing the attention or the response, it doesn't always have to be like, I feel like suicide that's the alarm bells.
Mm-hmm.
But depression is a spectrum.
So is suicide.
Right. Oh.
Just because you're suicidal doesn't mean you have a plan and intent.
Okay.
You can just live with the desire to not want to be here. That doesn't mean I'm going to do anything about it. So like I said, we created that thermometer.
I don't know how to respond to that. I mean,
it's people live with that every day.
It's something I've never heard. Well, okay, I have. I can think of an instance I've heard of it, but I didn't get it.
Mm-hmm. There's truly a spectrum. People who have no thoughts, people who have intrusive, fleeting thoughts, all the way up to a plan and intent. I know some people who I've met at 14 and their plan is for when they're 18. I have 4 years. I don't have to panic. I don't have to throw you in a hospital. I have 4 years to help you figure this out. That's actually really common.
Very.
It feels almost more scary?
It is.
Or heavier?
It's all heavy.
That's true. That's true. I'm looking at the time here because I feel like we could do this for about 7 more hours. I'm not sure anyone would listen. So I do want to.
My mom might.
Well, listen. When I started doing shows, I really just wanted my mom. Mommy, I'm doing something. But I do want to give some time to. There are some things coming up through ReDiscover, some events and some things that are hitting all of these topics and getting the word out. So what do we got coming up this month?
I'll let Heather say hers.
Yeah, I'll kick off with, we have a 988 day, and so that is on September 8th, also 9/8, hence the 988 day. So this is really just a day for awareness. We have, I'm really encouraging people to get out and try to talk about 988. You you are welcome to meet with me and grab some posters and go hang them up somewhere. We have tons of 988 posters. We are doing different groups and community events. We may paint some rocks and put them out. It's really a day of hope, I see it as, to remind people that there are resources here. You matter. We want everyone to know about 988. We want everyone to have a safe space that they can go to, or a safe person they can turn to. So September 8th, yes, get with your local community mental health center if you want to get involved. I know a lot of the different community mental health centers in the area are doing different activities that day. So I'd be happy to be available and provide posters and whatever else I can to bring awareness.
How can they contact you, ReDiscover? How can they do that?
Yeah, so you can either call our main line at 816-966-0900. I'm extension 1612, or you can email me at hmason@rediscovermh.org, and I'd be happy to connect with you prior to Monday.
Awesome.
I don't want to speak for your merch, but at one point you had like coloring books for 988.
Yes, we're kind of limited on some of our swag. We're working on it, but we do, if there's a small supply, we might be able to help with some
or
coloring
maybe
books.
even the website. I just am thinking about ways to target younger children like we were talking about. I have a 5-year-old and a 2-year-old. They have 988 color books from events we've been to. But
Missouri also has, if you just Google Missouri 988 and also look through SAMHSA's website, you can order a ton of 988 swag and have it delivered. Yeah. It will be post 988 day, but hey, we can spread 988 awareness all year long. So
it's never too late to learn,
yes,
or to practice. I want to go back to that.
Yeah, and it's never too young, which is why I did the plug for the coloring books, because I think it's a way to start a conversation with younger children just about resources. We teach what 911 is really young, and they know that's what for emergencies. There's no reason why we can't start teaching about 988 at a young age, too.
Well, I love that. And that makes it easier when they're 13 and 14.
Yeah.
And you have to force yourself to ask the questions.
Yeah.
So some programs are, like with the DARE and IMPACT programs. I know a few have put in information about 988. So we served, when I looked last, ages 6 to 100 this past year. So really it's for anybody. Mm-hmm. So
we've added it into the SOS days too.
Yes.
And Kirstie, you have an event coming up too.
I do.
And really, I just want to know about hoodies, because I heard there were hoodies.
There are hoodies. They are for purchase. September 27th from 9 to noon. I do know that is Oktoberfest downtown Lee Summit, so hop on over to us first. Is my vibe. Like, come get your coffee, get your walk in, and then go downtown for your
and you
pretzel
might need to
and
get your hoodie. What if it's chilly during
Oktoberfest?
So
on September 27th from 9 to noon, we have an awareness walk. It's our 3rd annual. It's really our way to show the community what resources are out there. It's our way to kind of brag about our program. So I'm in charge of the suicide prevention programs at ReDiscover. So there's some statistics, there's some quotes from our clients, there's some merch for purchase. You can actually purchase it ahead of time, no hassle. We won't have a lot on hand at the walk actually. But I've got a QR code and a link that I can send you to put in the show notes of this. We've got t-shirts and hoodies, white, gray, and black options for both. Some fun quotes. It's very non-conspicuous in terms of ReDiscover. It still represents us, but we wanted community members to feel prideful about what they were wearing and not feel like they were just a poster for ReDiscover Mental Health, or feel like that was identifying them in some way. So we were very thoughtful. Our slogan for the past several years, which is very common in the suicide prevention world, is "Tomorrow Needs You." So that's really been our focus. We also will have some pinwheels available. Those are free, not necessarily for purchase, but there's an opportunity to honor a loved one if you've lost them to suicide. There's a little card attached to each pinwheel. They can write their names in it, and then there's a spot they can stick it in the ground. One trail at Lowenstein is the walking trail, and then this year we did add a running trail for those who are interested, and there will be light refreshments.
The running people aren't my friends.
That's fair. It is a free event. I will send you the registration link. We do ask that people still register just so I make sure I have enough food. And then, like I said, merch is for purchase. Don't quote me, but I think t-shirts are $30 and hoodies are $50.
Nice.
All of the money goes directly back into our program.
I know you said you were intentionally being a little subtle with the ReDiscover branding, but I think there are still a lot of people who don't know that ReDiscover is right here in town.
Oh, I agree.
And they don't know the services provided. The ones who know have used it, is kind of what I feel like. So can you both brag just a little bit, I think, and what is ReDiscover? What are you guys doing? What are those services available for people in our community? Because I think there are a lot of us that don't know.
Sure.
We're a local community mental health center. So we serve really anyone and everyone within our catchment. And so when we talk about catchment, that's Lee Summit is one of ours, but we also have surrounding areas in Eastern Jackson County. So for our crisis programs, we will often respond to them. We have urgent cares that they can come in on a walk-in basis. We have programs like Kirstie's team that we will refer to internally. You can walk in and get connected with therapy, case management, medication services, substance use services. We have a whole umbrella. And sometimes people will say, well, I don't need all that. Maybe I have my own private therapist. That's okay too. We still have crisis services that might be something that person could benefit as well. Maybe they need a bridge of medications. Maybe they need something like mobile crisis or co-response services. So we really have a variety of services to meet that person and to help them get where they need to be. So even if they walk in and they decide, well, maybe I didn't need this service, that person can triage them to another service in the community that might make more sense as well.
Yeah, I'll just add to that. Did you say substance use services too? Okay, I was really lost in what you were saying. We have over, I think it's 15 locations now. And truthfully, there's no wrong door. Like Heather was saying, call the number, get some more information, walk into any of our locations and someone's going to assist you. I've been at ReDiscover specifically for over a decade now, and I'm very proud of the work that they've done. We, as an agency, are very innovative and very on the front line, but we are the first ones to do it thoughtfully. So even if it doesn't mean being the first one to do it, we really think through what we're doing. And really, truly, no wrong door is a core belief of our CEO. I've seen it in action. We've also recently affiliated with Prodeo, so I think there's some really cool things to come from that in the future as well.
We're gonna do a whole show sometime on that.
Oh, good.
Yeah, that's exciting.
We're passionate about people. That's really our kind of slogan is we want to meet that person where they're at. We're passionate about their care, and we want to do the best that we can. And we have a variety of services, intensive outpatient, partial hospitalization we didn't talk about. So it can feel really overwhelming. We're throwing out PHP, IOP, crisis. Like, what is all this stuff? It's really overwhelming. So the goal is walk in. Yeah. We can do an assessment and we can help you find the best service for you.
And I think the other thing I like to add is we look like this. Like I'm quite literally, I was bragging about my children's tennis shoes I was in the other day. I have a friend who goes to court a lot for work, and she was helping me pick a dress out for a wedding a couple weeks ago. And she was like, doesn't your job have don't you have professional, nice clothing? And I was like, no, I wear Costco skirts and t-shirts most days. But that is important, I think, for people to hear. One, I'm old and buy my clothing at bulk grocery stores now, but also we are also just people. Years and years and years ago, I was always told in school, pay your dues, work for an agency, learn your community, pay your dues, and then go be private practice. I have been at ReDiscover since I graduated school, and I'm not the only one that tumbled into their jobs and has stayed. And I think that speaks volume to the culture of where we work. It's not just the work that we do; it's the people that do the work who are also passionate and keep us fulfilled in achieving our dreams too.
I think it's really important that you talked about the attire. That's not just kind of funny. I learned early on in my career as a young reporter was wear what you're covering, but I think that's the same kind of thing. Like if I'm going to help you, we're going to, I want to be approachable. And I mean, if you walked into a family wearing, a business suit, it would not be the same reaction.
No,
not at all.
No, I've actually had some teens who will come into my office because even though I manage a program, I'm a licensed therapist and carry a small caseload to keep my heart full of just doing therapy. And I've had several where they're like, where's your couch? What do you mean, where's my couch? Or where's your clipboard? This isn't the movies. My name's not Freud. Hello? For a while, I had a blow-up glitter chair in my office, and people were like, this? Yes, this is, I want you to feel comfortable and safe in here. I have no problem
believing that you had a blow-up glitter chair.
Yeah, it got popped. It was tragic.
This does not surprise me.
It got popped, and it was a tragic moment.
All the sparkles.
The sparkles.
I think when we talk about attire and even financially, it can be stressful of, oh my gosh, therapy, is that going to be expensive? I do want to hit on that. We will treat everyone regardless of ability to pay, uninsured, underinsured. We're going to serve you. We have sliding scale fees. We have a lot of different grants and things that cover different services. So we want people to come in and get assessed. We don't want finances to be a barrier. Our agency does a really good job of really, truly trying to work with people so that they are being served and getting their needs met.
Yeah.
That is awesome. Okay. Contact information. Where can people learn more about ReDiscover? Where can they go on the web? What's the number they can call?
We have a new website.
ReDiscoverMH.org, I believe.
It's newly designed, beautiful. You can find everything we talked about and more on there, along with our events. There's links for everything on those as well. We also have a gala coming up that we forgot to talk about.
September 18th.
Rediscover the Magic.
Yeah. Ooh. It is going to be down at the Abbott. It is kind of our new launch to a more formal annual fundraiser. Mm-hmm. It's going to be amazing. I think there's going to be magicians. There's going to be great food. It's going to be fun. Look at our website. I would definitely encourage people to come. Yeah. It's a great way to support what we've been talking about, and it's going to be fun.
And a great way to know where your dollars are going.
Yeah.
Be able to see it in action, meet some of the people.
I like that. And as we close, I'm gonna go. Here's what I pulled out of today's conversation. Call 988. Practice.
Woohoo!
There we go.
And go to Costco for your scores.
And go to Costco. Who doesn't love Costco? I call it the $500 store.
Yeah.
Yes.
Really.
Oh my gosh.
It's hard to come out.
I don't have Costco in my area. I don't know why I'm saying Costco. It's definitely a Sam's Club score, but same thing.
Kirstie, Heather, thanks so much for coming on. I appreciate it.
Yeah.
Thank you for having me.
Thank you.
That'll wrap us up for this week. We'll talk to everybody next time.